So constipation in children. Actually, constipation in children is a common problem that is an infrequent passage of stool associated with pain and difficulty or delay in defecation. So it is infrequent passage of stool. Normally the infants, 95% of them will pass more than one stool per day. Okay, and the school children also 95% of them will pass more or equal 3 stools per week. If we have less than this frequency, then we have infrequent passage of stool and maybe associated with pain and difficulty or delay in defecation. This is the constipation. As I told you, is a common problem in childhood. About 5% of school children will have a significant constipation. Okay, usually the cause of constipation are functional causes. Okay, so idiopathic causes due to diet, to lifestyle, and so on. In less cases, we find an organic causes of constipation, and we more likely suspect the organic causes of constipation if we have a delayed passage of meconium beyond 24 hours after birth. Now let's start with the causes of constipation. Actually, you have to categorize the causes of constipation to 3 categories: the idiopathic constipation, the gastrointestinal constipation, and the non-gastrointestinal constipation. The idiopathic constipation is the commonest cause of constipation. It is a combination of bad food administration and lack of mobility and poor colonic motility. Okay, so low fiber diet will lead to constipation. Lack of mobility and exercise will lead to constipation. Ask anyone to sit in his place for a long time and he will definitely have constipation after time. Okay, so, and poor colonic motility. Now this is a familial case where the family has a poor colonic motility that will lead to constipation. So this is the idiopathic or functional constipation. We may have gastrointestinal causes of constipation, like an obstruction due to Hirschsprung disease. Hirschsprung disease, we have aganglionic mucosa of the colon, and the aganglionic mucosa of the colon will lead to decrease or absence of tone at point or some points of the colon, and that will lead to functional obstruction of the colon and constipation as a result. Also, if we have an anal diseases, like infection of the anus, stenosis of the anus, hypertonic sphincter due to genital or neurological disease. Fissure, anal fissure is a cause of constipation, and it is sometimes a result of constipation. So the anal fissure causes constipation, the constipation causes anal fissure. Presence of adhesions in the anus or in the colon will lead to constipation. Okay, intestinal obstruction due to any cause, adhesions, interception, and so on. Okay, volvulus, or anything can cause intestinal obstruction may lead to constipation. So intestinal obstruction, anal diseases, and Hirschsprung disease. This is the gastrointestinal causes. What about the non-gastrointestinal causes? I prefer to categorize them into endocrine causes like hypothyroidism or hypercalcemia. Okay, neurological diseases may also lead to constipation if you have some problem with the anal tone. Chronic metabolic causes like chronic dehydration, like celiac disease or food hypersensitivity. You all know that celiac disease is a cause of diarrhea, but sometimes, yes, celiac disease may present with constipation. Okay, drugs like opioids, anticholinergic may lead to constipation. Sexual abuse is a cause of constipation. So please categorize them into idiopathic, gastrointestinal, and non-gastrointestinal. The idiopathic, just like low fiber diet, lack of mobility, poor colonic motility. Okay, the gastrointestinal, like Hirschsprung disease, intestinal obstruction, anal fissure. The non-gastrointestinal cause like hypothyroidism. The endocrine causes hypothyroidism, hypercalcemia. The neurological causes neurological spinal disease or chronic dehydration, celiac disease, sexual abuse, and so on. Okay, the presentation of constipation. Okay, so it is easy to expect what the the presentation of constipation. So this is the esophagus, this is the stomach, and this is the colon. Okay, I know I'm not very good at painting, is just okay. So if you have some stool in there that is impacted and you have a constipation, first that will cause you pain due to the distension. So you will have abdominal pain and you will have abdominal distension. Okay, so and the constipation by itself is a presentation, infrequent stool or straining when defecation. Okay, so this is a presentation of constipation, straining or infrequent stool. The presence of stool in the colon will lead to abdominal pain, will lead to abdominal distension. Okay, anal pain on defecation. Why? Because the stool that present here for a long time will finally be hard stool and impacted stool, and the hard stool passage in, through the anal canal will lead to anal pain on defecation because it's hard stool. Okay, fresh rectal bleeding because this hard stool may lead to anal fissure. I told you that constipation is a cause of anal fissure and the anal fissure is a cause of constipation. So anal fissure due to the stool impaction, okay, and that may lead to fresh rectal bleeding. Okay, anorexia, of course, patient that has all these symptoms, of course he will have anorexia. Flatulence and growth retardation, also presentations of constipation. How to investigate constipation? Actually, most of cases you do not have to investigate constipation. It is not necessary because, as I told you, most of cases are idiopathic constipation or familial constipation, so you don't have to investigate. But if you suspect the presence of organic cause, then you can investigate. How to investigate? Just remember the possible causes. Okay, so if you suspect Hirschsprung disease, for example, okay, gastrointestinal Hirschsprung disease, what to do? You have to do rectal biopsy for Hirschsprung disease. Okay, if you suspect intestinal obstruction, okay, due to intussusception and any other cause, you have to do abdominal X-ray. Okay, if you suspect non-gastrointestinal causes like endocrine causes like hypothyroidism, you have to check the TSH, T3 and T4. Okay, hypercalcemia, you have to check for serum calcium. Okay, celiac disease also is a cause of constipation, as I told you. So celiac antibody screening like TTG and anti-endomyl cell antibodies should be checking. Okay, if you have a neurological disease or neurological suspicion, spinal disease, you have to do spinal imaging and you may do anal manometry. Okay, so remember the causes, the possible causes of constipation. According to the cause, you investigate Hirschsprung rectal biopsy. The hypothyroidism, you do TSH, hypercalcemia, calcium serum level. Neurological disease, you do CT scan, MRI sometimes. Okay, if you have intestinal obstruction, abdominal X-ray. For celiac disease, you do anti-celiac antibodies. And okay, what about the management of celiac disease? Okay, you have to treat in a stepwise manner. Okay, the management of constipation. The management of constipation is not just to give a medication. You have to control the diet of the child. You have to control the behaviors of the child. How to control the diet? You increase oral fluid intake, you increase fiber intake, and you increase natural laxatives, just like a fruit juice. Okay, fiber intake, just like salads or vegetables. Okay, so on. Behavioral measures, you have to train the child to have regular 5 minutes toilet just after the meals. Okay, and there are some charts and such things, schedules that may be helpful. Okay, now let's move to the medication. The aim of medication are two aims. Okay, the first one is to disimpact the impacted stool that you have. Okay, you have to disimpact that stool and you have to maintain that achievement. The disimpaction must be maintained. So this is the goal of the medication that we give in constipation. Okay, and you have to emphasize the need for consistency and adherence to treatment for at least 3 months. Okay, treat for at least 3 months. Very important. You can't treat constipation just for 1 or 2 weeks. You have to treat for 3 months. The patient must be consistent and adhere to the medication. Okay, because poor adherence and failure to evacuate fecal masses will cause some serious problems, some cases. Okay, you can give regular oral fecal softeners like Movicol, lactulose, or sodium docusate. Okay, and this will lead and aid to disimpaction. Okay, you can give oral stimulant laxatives like sodium bisulfate. Okay, so oral stimulant laxatives, oral fecal softeners. Okay, if you have anal fissure, you have to consider treatment, because sometimes you have voluntary constipation due to the patient afraid of having pain if he if he defecates. Okay, so you have to treat anal fissure as present. Oral magnesium citrate may be given, magnesium phosphate, or large volume polyethylene glycol all may be given. Okay, enemas, you all hear about enemas that will soften the stool and induce the defecation. Okay, only if no response to intensive treatment with above things, you give enema. So the enema is the final choice after giving the regular fecal oral fecal softeners like Movicol, lactulose, or sodium, after giving the oral stimulant laxative like sodium bisulfate. Okay, and after treating the anal fissure, changing the lifestyle of diet and behaviors. The last thing to do is to give enema. Okay, hospital admission may be required for the most severe cases. Okay, so what can be done in hospital admission? Manual evacuation under sedation may be measured to do. Okay, or general anesthesia may be required, not just local sedation. Okay, and so these are the measures of treatment. So remember always, to treat constipation you have to treat the lifestyle of the patient, and then you give medications like oral softeners, like oral fecal oral laxatives like enema, and treating the underlying cause. Of course, if you have you have to treat the underlying cause. This is the first thing to do. If you have hypercalcemia, treat the hypercalcemia. Hypothyroidism, treat the thyroid gland. And if you have Hirschsprung, it needs surgery. Okay, and so on. So this is constipation. I talked about the definition of constipation, the causes of constipation, epidemiology, presentation, investigations, and management of constipation. Thank you very much for watching this video. See you in the next video.